would you support a pay cut of 20 to 30% across the board of federal employees? CBO stated that employees are being hired at 180% more than private sector. Okay, the issue on federal employment is this. Number one, we need to reduce the federal workforce. How do you do that? You just don't do it by saying, well, we're not going to hire people. No, you have to do it by getting rid of federal programs. All right? You have to do it by taking folks who are taking programs that do not belong at the federal level. For example, I was the author of welfare reform, as I mentioned before. What did we do with welfare? It was a federal entitlement. Aid to families with dependent children. Remember that program? AFDC. AFDC was a federal entitlement program that was federally run, and I authored a bill that ended the federal entitlement, block granted the money to the states, gave the states the flexibility to operate that program, put two major conditions on it. One, a time limit on welfare. Two, a work requirement if you were to receive welfare and you're not disabled. Right? What happened? The states were thrilled to have the program back. We provided stable funding. We didn't grow funding. We provided flat funding. Imagine Medicare, food stamps had flat funding. States said, we'll take it because we can save money because you're going to allow us the flexibility to do it. Guess what happened? Welfare rolls went down by, anybody know? 50% on average. In the state of Wisconsin, 92%. And they were cash flush. Why? Because we gave them the flexibility to root out the waste and the fraud. Not every state did it. California didn't. New York didn't. Right? And so look at their budget situations. Now imagine we can do that to Medicaid. We can do that to food stamps. The welfare rolls today are lower today than they were in 1996, and we're in the third or fourth year of a recession. And in 1996, we're in the midst of a recovery. And still the welfare rolls were higher then than now, and we have more people in this country now. So think about how bloated those rolls were. Well, we can think about that because we now have more people on food stamps than any other time in the history of this country. And what is the number one problem among the poor in America, health-wise? Obesity. Oh, it's because people eat bad food. Baloney. Well, no, I didn't mean that. That's a good line, but I didn't think of it. But it's not because of baloney. All right? The problem is this is a problem that needs a solution, which is getting the money back to the states, back to the local communities, where the care is being. We're harming our society by taking your money, and with it, what too many people in America believe is their responsibility to care for their brother in need in our society. Charity is about giving up one's heart, right? And of course, resources. And what we're doing is we're robbing people of the dignity of helping somebody by making it harder and harder for you to do it because government is taking more and more, right? And we're not helping, we're not creating those ties in society, those social bonds within a community. I know what happens in a lot of communities where people do get involved and help their neighbors, but it's harder and harder, and unfortunately you're seeing less and less as government gets bigger and bigger, and they don't need that. The people in front of you with the debit card that can buy things that you can't afford to buy. That's not a society, that's not a healthy thing for society. And so we need to get these programs back. Food stamps, Medicaid, housing programs, education programs, training programs back to the state level. How are we doing on time? Is my right?